Namaste and good afternoon. Greetings from all of us at Apollo Hospitals and welcome to our corporate health series. This is Dr. Srinidhi Chidambaram and I hope you're all staying safe and keeping great health. Our aim in presenting this series is to bring you awareness on health and well-being so that you can enjoy a productive and successful journey ahead. And I do hope that you're regularly following these sessions and also finding them useful. Our habits and lifestyle make us what we are. While a lifetime of healthy habits like a balanced diet, exercise, good sleep would enhance your health, the reverse is also true. If you abuse your body, you pay the price at the end. Heart health is one of the most vital components that affect your productivity, your quality of life, and your lifespan. The important thing to remember is that there are many factors that you can control to reduce the risk of developing heart disease. This is because many lifestyle factors like obesity or unhealthy diet or physical inactivity can contribute to the development of heart conditions, especially coronary artery disease, where there is plaque buildup in the arteries that supply your heart. And this can lead to what we know as heart attack through the buildup of these plaques. And another important factor that contributes to this is also high cholesterol in the body, which is what we are going to discuss today. You need to be aware of factors that you can control, though there are factors sometimes that are beyond your control also, like genetic makeup or certain other health conditions. But by and large, heart health is something that you can control, and that's what we are going to learn today, particularly about this term that we all know and talk about, cholesterol, but we need to know exactly how to make sure that this doesn't affect our health. To talk to us about this important topic, I am delighted to welcome Dr. Varsha Kiran, who is a distinguished cardiologist with over a decade of experience, currently practicing at Apollo Medical Center at Kondapur in Hyderabad. A product of the prestigious Christian Medical College, Vellore, Dr. Kiran holds an MD in General Medicine, a DM in Cardiology, and additional qualifications such as DNB Cardiology, FESC, and FSCAI, which underscores his immense expertise in cardiology. Dr. Kiran offers a versatile and comprehensive range of treatments for heart disease, including angioplasty, implantable cardioverter defibrillator placement, transesophageal echocardiogram, pacemaker insertion, catheter ablation, mitral valve repair, balloon mitral valvotomy, and arrhythmia management. His particular interests lie in peripheral interventions, pacemaker and ICD implantation, and cardiac rehabilitation. His exceptional contributions to cardiology have earned him several accolades, including the Dr. J.C.M. Shastri Memorial Prize, the Gwenda Lewis Prize, and the Dr. Philip Corolla Medal. In addition to his clinical practice, Dr. Kiran is also a prolific writer with numerous contributions to national and international medical journals. Welcome, Dr. Kiran, to this corporate health series. Thank you so much for joining us. So let's first ask you what overall contributes to heart health. How can especially our busy corporate professionals take care of their heart health?
Thank you, Dr. Srinidhi, for having me. I think it's a very good initiative to have lectures like this to kind of spread awareness. Basically, I think everybody knows bits and pieces, but nobody puts it all together to implement it in their daily life. So I think getting right back at the question, how to kind of take care of your heart health, I think you kind of mentioned a lot of these factors to begin with. I think I would probably use the words modifiable and non-modifiable in the risk factor category. So as you did mention, certain factors are non-modifiable, like the genetic makeup. If you have a genetic predisposition, male gender by itself is a non-modifiable risk factor. But on top of that, there are so many risk factors which are essentially modifiable. So by modifiable, I mean we can control it by our own means. Things like smoking, physical inactivity, obesity, all are necessarily risk factors which can easily be modified by one's own self. And there are other risks like control of sugars, control of blood pressure, and most importantly, I think the topic of the day, lipid management, is essentially control of cholesterol. All these contribute to basically a healthy lifestyle.
So let's talk a bit about lipid management. So everybody uses this term cholesterol is bad. So what is exactly cholesterol and what is its function in the body?
Yeah, so I think we should rephrase that question as cholesterol is not bad, it's excess cholesterol that is bad. So essentially, in very simple terms, cholesterol is nothing but the fatty substance that is present in the body. So essentially, it is something that is not dissolvable in water, essentially not dissolvable in blood. So cholesterol is basically something that is actually one of the basic components of human body. I mean, not just human, many organisms need cholesterol. So it actually serves a lot of important and vital functions. Like for example, a lot of hormones that we produce, like the steroid hormones, they're all produced out of cholesterol. Cholesterol also is helpful in bile secretion by the liver, which helps in food digestion. Cholesterol actually forms the lining of all the cells in the body. So we call it the cell membrane. So essentially, cholesterol is one of the integral part of the body which is necessary for smooth function. It's the excess cholesterol that is bad. So, like I did mention before, it's not water soluble, so it kind of doesn't get dissolved in the water. So, whenever you have excess of cholesterol, it kind of freely floats around and it actually gets deposited in sites of predilection. By sites of predilection, I mean coronary arteries. Like it's one of the common sites of predilection for cholesterol deposition. So, whenever you have excess of cholesterol, since it doesn't dissolve in the blood, it goes and finds itself deposited in various tissues in the body, one of which can be life threatening, is in the coronary artery. That's the arterial supply to the heart. So with more and more duration of excess cholesterol in the body, the plaque buildup increases. So the more and more cholesterol gets deposited inside the artery, causing a blocked artery, which can result in chronic stable angina, or in worst cases, even a sudden cardiac arrest or a heart attack.
So could you explain that a bit for our audience, as in the whole coronary circulation and what exactly happens and what is angina, what is the heart attack?
Okay. So actually, like every cell in our body requires oxygen and nutrients for normal functioning. So heart being one of the most active organs in the body, like heart beats almost 10,000 times an hour. So essentially, you need a lot of oxygen and blood supply going into the heart. So the coronary arteries is the arterial system which supplies blood and essentially nutrients and the oxygen to the heart muscles. So, like we mentioned before, when you have excess cholesterol, there is a lot of plaquing inside the coronary arteries. It's like, think of an analogy of a pipe, and the pipe is getting narrower and narrower. So as the pipe gets narrower, the amount of blood that gets supplied by the pipe reduces. So let us assume a hypothetical condition where you require, let's say, 100 ml of blood per minute for regular supply of blood, oxygen, and nutrients. Over time, with the plaque buildup, the amount of blood that gets supplied reduces drastically. So when the supply reduces beyond a critical level is when we start feeling angina. Angina is nothing but the cry of the dying heart muscles in very simplistic terms. So, but common symptoms that patients come to us is history of chest pain or breathing difficulty, especially upon exertion. So, when you're resting, you may not really experience any symptoms, but the minute you exert yourself, be it walking, running, stair climb, you start feeling the pain or a heaviness over your chest, which is called a chronic stable angina. The other extreme is when you have a sudden rupture of the plaque, which results in a complete stoppage of blood flow to the heart, is when somebody suffers a heart attack. By heart attack, I mean a portion of the heart is not getting any blood flow, because of which, beyond 4 to 8 minutes of no blood flow, the heart muscles start dying. So, if it is not arrested as soon as possible, as soon as possible, we need to open up the blocked artery to prevent a long-term injury. So essentially, to summarize, heart gets its blood supply through coronary arteries. We have three coronary arteries. And when you have a plaque buildup causing a reduction in blood flow, that leads to angina. And when you have a sudden deterioration leading to zero blood flow, like 100% blocked artery, results in a heart attack.
Also, is it true that Asians have a narrower coronary artery? I mean, as it is, I don't think the coronary arteries are very large arteries. They're quite thin in diameter. Is it true that Indians have to be even more careful because of their genetically narrower artery?
I think, let me put it in two ways. I think one is we must realize the average body mass index or even the body surface area of Indian population is much lesser than a Western population, which is commonly quoted in the textbooks. Then also second thing is the Indian genetics is such that the incidence of lot of non-communicable diseases are much higher in Indian population than Western. Take for example diabetes. We are unfortunately the diabetes capital of the world, so with that comes a lot of additional baggage. So part of that is incidence of coronary artery disease as well. So yes, and also to clarify the question that you asked, there is enough data, especially the coronary imaging data. Like to give you an example, uh, so you were saying the arteries are small, so usually the left main artery is around 4 to 5 millimeters in diameter, and that splits into various branches. So the size of the main branches range anywhere between 2 to 3 millimeters. So that is how big the coronary arteries are. So there's enough data by use of intravascular imaging, which says that where in a Western population, 8 millimeters is the desired area, but in an Asian population, 4 to 6 mm is actually normal. So yes, so definitely the size of the arteries is lesser, and more importantly, we have a higher incidence of diseases like diabetes and hypertension, which makes us more vulnerable for having cardiovascular diseases.
We often hear this term of good and bad cholesterol. So, what is uh, the explanation for one's, like the lipid profile that we do on our blood tests? What are the things that are measured and what is normal?
Okay, so like we mentioned, cholesterol is essentially the fatty substance that kind of floats around in the blood. So since that doesn't dissolve in the blood, it needs a binding agent which takes it from one organ to other. So think of having two carrier boats. Like you have one boat which takes uh, takes your goods from the production factory to the supply chain, and there's another boat which kind of brings back the excess products from supply chain back to the production house. So in this analogy, your liver is the production house and your supply chain lies in the vascular territory like heart, kidneys, or brain arteries. So you have two distinct type of cholesterol. Like to simplify things, the bad cholesterol is the LDL, low density lipoproteins, commonly just used by the short phrase LDL. So LDL is bad because it's the lipoprotein which takes the cholesterol from the central production house, that is the liver, to the peripheral tissues. So when you have high LDL, it makes you prone for cholesterol plaquing in the carotid arteries, that is the arteries supplying the brain, in the coronary arteries, the arteries of the heart, and rest of the peripheral vasculature, like be it legs, kidneys, or anywhere else. The other side of the coin, the good cholesterol, is the boat which takes the cholesterol back from the supply chain to the central warehouse. So when you have a high density lipoprotein, that is the HDL, excess HDL helps in moving the cholesterol back from peripheries into the liver. So when you have high LDL, it makes you prone for cholesterol plaquing. When you have high HDL, it protects you from cholesterol plaquing. So that is an easier way of looking at cholesterol as good and bad.
So now let's talk about high cholesterol levels, LDL or overall total cholesterol. What makes that go up in people?
Okay, so I think so there was one very interesting study. I don't know how they found it when they actually looked at the cholesterol level of cavemen uh, based on some fossil data. They found that the LDL level of cavemen was around 30 to 40 units. So based on the hunter-gatherer lifestyle and etc., wherein their food intake was scarce and their physical activity was immense, the baseline LDL was very low. Over time, with industrialization and urbanization, physical inactivity, use of processed food, slowly the standard basic LDL levels have actually increased. So now coming back to your question as to how does it increase? Again, there are a lot of factors. One is the current urban lifestyle that we have, lack of physical activity, increased use of processed food. All this results in rise in cholesterol, and more importantly, excess intake of fatty substances, be it oil, ghee, or butter. All that kind of translates directly into excess cholesterol in the body. So what we must realize that body itself produces cholesterol. Like liver does produce cholesterol in the form of bile, which is useful for absorption. Is that when we consume excess of cholesterol, which we don't require, is when the body cholesterol stores start building up. Another source of high cholesterol is whatever excess calories that you eat, be in the form of proteins or glucose, and you do not spend. So, for example, let's say you consume 10 calories and you utilize only 2. The remaining 8 get converted into a storage form for long-term storage, which is essentially cholesterol. So essentially, excess consumption, reduced activity will result in building up of cholesterol in the body.
So, how often should somebody monitor their lipid levels?
Yeah. So yeah, let's look at the two groups of people. Let's look at a group of individuals who have no major cardiovascular risk factors. So let's give a typical example of a 35-year-old gentleman who's not a diabetic, not a hypertensive, has no family history, doesn't smoke. So he falls under the low risk category. I would probably test cholesterols every 6 months to 1 year in such a person. Let's look at the other end of the spectrum. Let's take a 50-year-old person who's got diabetes or hypertension or smoker, or let's say a family history of premature coronary artery disease. I would probably check it every 3 to 6 months. And maybe the third group of people, somebody who's already had a cardiovascular event, be it in the form of heart attack or a brain stroke, or having undergone a bypass or a stent procedure, who's already on a cholesterol lowering medication. In such people, I would probably be a little more stringent in testing. Maybe once in 3 months would be ideal in such a profile. So to summarize, low risk individuals, 6 months to 1 year, intermediate moderate risk individuals, 3 months to 6 months, and high risk individuals, 3 months or earlier.
Now coming to how one can actually, you did touch upon some of the aspects which can help people to reduce their cholesterol. So supposing somebody is diagnosed with high cholesterol, what are the measures that they can take in order to bring that back to normal?
Okay. So yeah, like I think we already discussed before, a lot of these factors are modifiable factors. So I think let's say we come across a young person who has high cholesterol and we are looking at a primary prevention. By primary prevention, I mean there is no documented coronary artery disease. In such people, it's probably worthwhile trying 3 to 6 months of non-medical therapy before jumping onto medication. So by non-medical therapy, I am kind of intending at lifestyle modification. So the major pillars of lifestyle modification would be cutting down the consumption of calories and excess fatty food, increasing physical activity. So the recommended average exercise duration should be 150 minutes per week in divided sessions, and essentially making sure cutting down smoking and other risky habits like excess alcohol consumption, etc. So I think the three pillars would be this: smoking cessation, habit reduction, exercise, and food moderation.
When we talk about food moderation, you did touch upon that again, but are there any specific foods that actually should be actively avoided for people who already have abnormal cholesterol or abnormal lipid levels?
Yeah. So I think in general, any sort of processed food and food which are highly fatty in nature, like oily food and let's say mode of cooking also really matters. Like instead of fried food, probably boiled food may be safer. Like I think a lot of patients ask me, is air fryer better than pan fried? Probably yes, because it takes slightly less oil in cooking than pan fried equivalent. So I think in general, see, basically it's impossible to tell a person to don't take oil at all. It's really impractical, especially in an Indian household. It's you don't have a lot of options left. So I think a simpler instruction I tend to give a lot of my patients is, you know how much oil you consume, so try to target half of that for the next 1 month and see how practical it is. And after a while, the half consumption becomes your normal for the months to come. And then you slowly cut down on the oil use further. And another common question, since you did bring it up, is which oil is actually the best? Is sunflower, flaxseed oil, sesame oil? So we must realize all these oils are extracted from different sources, and all of them have different uh, cholesterol factors which are actually essential for body's functioning. So I don't think there's any data or any scientific study which proves one oil being more superior to the other. I think in an Indian context, if you tell a Malayali person to stop eating coconut oil and eat groundnut oil, it's not practical. The same way you tell a Bengali not to eat mustard oil and switch to coconut oil, it's not practical. So I think a simpler instruction which can be easily followed would be continue your habits, but try to minimize the use. Like I think it's that is probably a easier solution to it. There's of course a lot of fad about use of olive oil based on the Mediterranean diet. So there have been data to say that the Mediterranean diet, which is actually rich in fruits, vegetables, and especially olive oil, is shown to slow down the uh, prospect of coronary artery disease or a lot of non-communicable diseases like diabetes and hypertension as well. But then again, you realize that standard Indian cooking cannot be done with olive oil because the boiling point is very different from the kind of food that we are used to. So,
But talking about fats, this is something that I wanted to ask. So now there is also this thing about good fats and bad fats. So certain things like, as you said, olive oil or avocados or certain foods are considered to be good fats, like you do need them, maybe seeds, all those things, some nuts. But at the same time, a bad rep is given to say like coconut or to egg yolks or to maybe coconut oil, certain nuts. So, what is it? Is that really just a fad, or is it really that, there are some fats which are good for you and some which are not? Or is it that it's just a question of calories and you just need to?
yeah. So I think a very simple way of looking at it is I don't think any fat is extremely good in excess. Everything is good in the extent that is necessary for the body. Like I said, cholesterol is an important material for the normal functioning of the body because it takes part in a lot of essential activities. So when it comes to which is better, which is bad, I think in general, if you divide all the fatty foods into animal based and plant based, it's proven beyond doubt that plant based is probably a little healthier choice compared to the animal based lipids. That is first point. And second point, like I said before, I don't think any one protein, one particular fat which is consumed in excess is not good. So I'll tell you a very simple example. There is a very famous diet which is practiced by a lot of people, which is essentially based on a lot of coconut oil. So it's essentially people kind of eat cashew nuts and then they literally drink few ml of coconut oil as a part of the diet because it is promoted as it kind of cleanses your gut and takes away a lot of things. So I have personal experience. I'd seen a patient who underwent a stent procedure, and after stent procedure he wanted to kind of mend his lifestyle, so he actually got into one of this coconut oil rich diet, and he actually came back to us within 6 months with a stent restenosis. And he was shell shocked. He said, I've hardly touched rice, I've hardly touched any sorts of calories. I don't know how my stent got blocked. So when we actually checked the cholesterol levels, it was pretty high, although his sugars were good. So I remember one of my teachers made a comment saying, whatever he ate, it didn't reach his intestine, it reached his heart. So, so I think the point here is I don't think there's anything that is good in excess when it's fat. So it has to be in
The
moderation.
fat going around, I think, is the ghee. So people often say the ghee is very good, and it's actually not. So, but what about the egg yolks, doctor? So that's another famous question that people always ask, whether one should only eat egg whites or are egg yolks okay? And there are a lot of misinformations, or I don't know if it's a misinformation, but many articles on the social media either for egg yolks or against them. So, what I'm sure our viewers would like to know about that as well.
Yeah, see, I think again, I would stick to the same story. I think as long as it's in moderation. So I do know a lot of my friends who are into putting on muscles when they go to gym. I see them eat like 6 to 7 eggs for breakfast. So I would certainly not recommend 6 to 7 egg yolks every day because that's a lot of fat. But then if somebody is eating 1 egg a day, I think whole egg would be better than just eating the whites. So
I
the,
think
the
eventually
point is
what you say,
moderation.
moderation, and I think the right balance between all food groups and macros. Right. So now we'll just conclude this session by talking a little bit about screening, since we are talking about heart health. So, what would your advice be to our audience on screening? And as you know, Apollo Hospitals has pioneered our health check program. It's been our chairman's vision, so it's evolved into the Pro Health program. So, what is it that you would advise people to do when it comes to, especially corporate audiences who are usually too busy for anything at all? So, what would you suggest that they do?
Yeah, so I think, like I said, I think this is something that I follow in my routine clinical practice. So somebody who's under 40 years of age, maybe once in 2 years, a complete heart check would be worthwhile. And by the time you cross 40, maybe once a year would be worthwhile. And when it comes to what all investigations are to be done, I think in terms of blood work, it's good to kind of look at the sugars, like basically the fasting sugar, postprandial, and HbA1c. That's the average sugar over 3 months, along with lipid profile. And other basic blood tests like CBC and etc. And when it comes to dedicated heart-specific investigations, I think a standard 12 lead ECG, echo, and a treadmill, they would be good enough to kind of filter 70 to 80% of chronic cardiac ailments. So I think I would recommend these. I think, yeah, like you already did mention, I think it's pretty much streamlined the way ProHealth checkups are done, and the data is stored for serial monitoring and risk stratification of patient. I think audience also needs to know about the uh, cardiac risk score that is strategized and tested in our Indian population, which helps in stratifying patients who probably don't have any documented disease yet, but I think that score is a useful score to kind of follow up patients, follow people in future.
Yes. So, the last question that I'd like to ask you is regarding, again, our corporate audience. So, what would be the one thing that you would tell them to do when it comes to heart health? Because a lot of them have many of the factors that go towards being high risk. They might be traveling a lot. They might not be able to eat healthy all the time. There might be a lot of stress. There might be smoking. There might be a lot of sleep disturbances. Pretty much everything that sets the stage for a non communicable disease. So, what would be your final word to them?
Yeah, I think final word is I think a three-pronged approach. One is diet, essentially cut down on excess calories, cut down on excess fats. Second thing is physical activity, 150 minutes of aerobic activities a week. And third is smoking and alcohol moderation. I think in summary, I would say these are the three essential pillars to take care. Not just for cholesterol, it helps in better glycemic, like diabetic control. It helps in lowering of hypertension. It helps in control of PCOS. So if you look at all these diabetic reversal programs or hypertension reversal programs, to summarize, these are the three things that they follow. So it's not rocket science, or it's not something that is out of the blue. It's fairly simple, but it's just that you need a lot of dedication and stick to these three principles.
I think the consistency and keeping it non-negotiable, and I think a bit of pre-planning also helps in putting this into your schedule so that you don't miss it. So that's a key takeaway there. Thank you so much, Dr. Varsha Kiran, for this wonderful session, which I think was very simple and very illuminating. Dear viewers, I hope that you enjoyed this session too. So please remember the key takeaways, simple, but be consistent in your diet, in your exercise, and in not smoking and moderating your alcohol consumption. And I'm sure that will keep your body healthy and your heart is sure to thank you for it. See you next time. Namaste.
Yeah, thank you. Have a nice day.